Good evening, everyone. I'm Riley King, and welcome to this special report right here on the Riley King Network. Let's begin. Seacoast Town health leaders urge Sununu to order shelter in place. Town officials have disrupted strict new behavior recommendations aimed at limiting the spread of the coronavirus. Officials disrupted the recommendations on the town's email list, which goes to about 3,300 subscribers, according to Town Administrator Todd Seelig. State Senator Martha Fuller Clark joined Durham Town Councilors on Saturday in supporting a call for Governor Chris Sununu to issue an immediate shelter-in-place order. That call was made Friday by the leadership of Exeter Hospital, Exeter Area Chamber of Commerce, SAU 16, Phillips Exeter Academy, the Exeter Select Board, Exeter Town Manager Russell Dean, and River Woods. Fuller Clark confirmed Saturday her husband tested positive for COVID-19. Fuller Clark said she is not showing any symptoms at this time, and she and her husband are in self-isolation at their Portsmouth home. New Hampshire's count of COVID-19 cases rose to 65 by early Saturday evening. In addition to residents, Durham's recommendations are aimed at University of New Hampshire students, Seelig said. If you live here, you're part of our community, he said. The recommendations were made based on advice. The recommendations from Boston area physicians, Seelig said Friday. They recommend eliminating play dates, even one-on-one, eliminating small gatherings, including meetings between a few families. Avoid climbing gyms, restaurants, movie theaters, anything in an enclosed area. Many of these places are advertising increased cleaning and hygiene. This is not significant. Do not go. Canceling planned vacations for the next month and avoid airline travel. Staying at home as much as possible. They also advise working from home if possible, and when you do have to go out to buy groceries or medicine, make the trips quick and purposeful. Washing your hands thoroughly for 20 seconds after you've been in a public place. Avoid dismantling claims that the situation is not serious. This is a national crisis, and conveying misinformation to your friends and family may put your lives in danger, town officials said. Seelig acknowledged Friday the recommendations to some degree could result in people isolating at home. At certain points, desperate times demand desperate measures, Seelig said. In the best interest of our community, we really need people to self-isolate as much as possible. For most people, COVID-19 results in only mild or moderate symptoms such as fever and cough. People with mild illness recover in about 2 weeks, while those with more severe illness may take 3 to 6 weeks to recover, according to the World Health Organization. For some, especially older adults and people with existing health problems, it may cause more severe illness, including pneumonia or death. Town officials decided to issue the recommendations apart because they say inconsistent in what they were being told by the federal and state officials, Selig said. He added that during the early part of the health crisis, there was a lot of downplaying it by federal leaders. That's why town officials decided to release the behavior recommendations based on the medical advance of Boston area doctors, Selig said. Plus, it becomes clear many people were not taking the federal or state recommendations seriously, even after public schools closed and UNH also went into remote learning. During the pandemic, that really represents high-risk behavior, which puts them in jeopardy and the rest of the community in jeopardy, Selig said. Given that, I thought it made sense to be very clear on expectations. These expectations include UNH students, especially now that UNH canceled all in-person classes for the rest of the semester. Selig estimated about 20 to 30% of UNH students living off campus remain in Durham. Unless they're international students and have literally nowhere else to go, students should return home, Selig said. It's often heard to convene students to follow such recommendations, Selig acknowledged, because they tend to think they're invincible and can't be hurt. Selig understands the town's recommendations combined with orders issued by Sununu concerning restaurants in particular will impact Durham businesses. He believes people should still prioritize restaurants offering takeout, but encourage them to get their food and not hang out and talk to groups of people. The Center for Disease Control and Prevention issued a series of recommendations to protect yourself and others from the virus. Number 1, cleaning your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. Number 2, avoid touching your eyes, nose, and mouth with unwashed hands. Number 3, avoid close contact with people who are sick. Number 4, put distance between yourself and others if the virus is spreading in your community. This is especially important for people who are at high risk of getting sick. And the last one, stay home. If you are sick, expect to get medical care. And that does it for my special report right here on the Riley King Network. And we want to hear from you. What do you think? Do you think Governor Chris Sununu should issue a shelter-in-place order? Comment below and let us know. We want to hear from you. Thank you for watching this special report right here on the Riley King Network. Good night and bye, everyone.